Okay, um, I believe I am live. This is Dr. Shannon Clark with Babies After 35. I am waiting for Dr. Jani Jensen to join us. There she is. Let's see here. If there's any problems with you guys hearing us, somebody please put a comment so we will know. Hi,
How are you?
I'm doing well. You look gorgeous.
Oh, thank you. Yes,
I
I
was, I,
earrings for you, and I
Thank
thought I
you so much.
would a little shirt. Yeah, hi.
Yeah, so I might have to take my, do you have headphones?
Yeah, I do. I can
Yeah,
connect them.
yeah, put them because we'll try it with the headphones. If that doesn't work, then we both have to use them, have to take them
Okay.
out. Sometimes there's a little bit of delay if one person has it and one doesn't. Okay, you got it? Okay. All right. Well, I want to thank you so much for taking time out today to do this conversation and discussion with me. So I really do appreciate it. I'm sure you value your weekends just as much as I do. So I appreciate it.
To be here. This is one of my favorite things to talk about. So this is a great opportunity.
Perfect. Okay. So I'm just going to do a brief introduction. Again, I'm Dr. Shannon Clark with Babies After 35. And joining me is Dr. Jani Jensen. You are in the Twin Cities, right? In Minnesota?
That's correct.
Yeah. So, and with Reproductive Medicine and Infertility Associates. So if you guys want to find her, she's also on Instagram at Fancy Lady Doctor. And it's all over mine too, so you can find her there. But I wanted to dive right in. We're going to cover three main topics. The first is going to be family building for gay men, and then lesbian couples, and then finally trans couples or trans individuals. And I just want to start by saying it doesn't have to be couples. People can do this on their own. And I'm sure that you see that a lot as well. And so I just want to make sure that we address that as we go along. At about halfway through, we'll probably stop to see if there's any questions,
Sure.
and then pick up where we left off. Okay. So the
Great.
first thing I want to talk about is for gay family building. So I kind of narrowed it down to first, you have a gay male couple. They need to first pick an egg donor, then a gestational carrier, then decide who donates the sperm, and then finally go through the IVF process. So let's talk first about egg donor. So how do they go about choosing egg donor?
Well, they're finding an egg donor actually is probably the easiest part for a lot of couples because now we have the option to be able to order frozen eggs from an egg bank, and they work really well. So when we're talking about donors, there are in general two types of donors: known donors or anonymous donors. And in my practice, we work with both. And so a known donor is exactly what it sounds like. And sometimes you can have a gay couple and one will maybe have a sister or some other type of genetic connection, and that person can choose to be an egg donor. Now, most people don't have that luxury. So
Mm-hmm.
if you don't have that, we are able, as I said, to get eggs from another person. And the one thing that's really important is when someone chooses to donate eggs or sperm or even embryos, there's extensive screening that needs to be done. And this is mandated by the FDA. So it's not Janie and her rules being tough on somebody.
Yeah.
It's really legal requirements that we have to do.
Mm-hmm.
And it can take longer to get a known donor screened
Yeah.
because if we are ordering eggs from an egg bank, for example, the donor has already gone through all of the necessary screening and testing before the eggs are able to be frozen. And with an anonymous donor, all of that is
Mm-hmm.
done. So we can
Yeah.
order eggs. Eggs are sent to us fairly quickly. I joked once that it was like Amazon Prime shipping, and one of my patients called our clinic the next day to ask where his eggs were. But the eggs can come fairly
Thanks.
rapidly.
Yeah.
Yeah, if your sister, if I'm in Minneapolis and you're going to use someone's sister and she happens to be in Seattle, it may take
Yeah.
a little bit longer logistically to be able to get all the necessary steps done. And
So
one
is
important,
there
oh, go ahead, sorry.
No, so is there any benefit? Okay, so I had got pregnant through egg donation. So there was the talk about, having my own dedicated egg donor where all the eggs that she produced were mine versus using potentially frozen eggs. Is there any benefit to each one as far as the quality of the eggs, the quantity of the eggs? If you choose to do frozen eggs, is there a guaranteed number of eggs that you get? I know you don't know what the anonymous donor, or what, I don't know if fresh donor is the right way to call it, but the designated donor for you never know until you go through it how many eggs you get. But would you know if you did the frozen donor, like something that was already there?
Yes, so
Okay.
the way that the donor eggs are usually allocated will do the math very pessimistically, and they'll say that if you have 6 eggs, maybe 5 will survive the thawing process and maybe 4 will fertilize. And then out of those 4 fertilized eggs, we may end up getting, 2 or so usable embryos. So I always start with how many children do you want to have? Because if it's really important for you to, so in 6 eggs will translate typically to at least 1 attempt at pregnancy, but you can't count on more. I've definitely had 6 patients who get 6 eggs from an egg bank, 6 survive, 6 embryos, but that's really the exception rather than the rule.
Yeah.
So I want people to pessimistically think about 6 eggs as being 1 solid attempt at pregnancy. So if you were a couple that knew that you wanted to have 2 or 3 pregnancies, you should either try to select a donor that has a larger cohort or group of eggs that are available, probably something in the 10 to 12 group. And you are right. If you choose to have, let's say, a known donor, it's your younger sister to donate eggs for you, for example, she could be vary in the amount of eggs that she produces. One advantage, though, with her is potentially she could do it more than 1 time for you as well.
Okay. Is if you choose without the frozen, if they choose a donor that they start with from scratch, is it ever possible that they could use the same donor for multiple cycles potentially?
Yes, that is.
Okay.
And so sometimes you will see donors that aren't active, and this is actually true for sperm donors too. I've had several patients that use donor sperm. They go to look at the inventory at the bank and it's not there. But banks are required to keep records. So in our practice, we also get donors and we have to keep their information for over 10 years. So it is possible sometimes that even if we don't have a donor who's currently active, we can go back to that donor and make a request that they donate again to continue building a family. And we can't count on that, but it is a possibility as well.
Yeah. Okay. So we talked a little bit about egg donors. So now I also want to touch on, because in the media and even on social media, the surrogate is used very loosely. From what I understand, there's 2 types. There is the traditional surrogate versus a gestational carrier. What are the differences? And then what is predominantly used here in the States? Or does it vary from state to state?
Well, traditional surrogacy is almost never used in the United States. I'm not aware of any practices that do traditional surrogacy. So what you are 100% correct is that people use the term surrogate, but I will always say gestational carrier, but I know what people mean. So in the truest sense of the definition, a traditional surrogate is someone who provides the eggs and carries the pregnancy. Right. And in the worst possible scenario, this is like a Handmaid's Tale situation. So, and I'm again, in the United States, it's very frowned upon to do traditional surrogacy. And so most places are doing what we call third-party reproduction. So there's a separate genetic sperm source, egg source, and uterus kind of involved in especially cases that involve gay males.
Okay, gotcha. So I like to use the proper terminology as well. So gestational carriers, what we're going to refer to again, for those that are listening or just tuning in, traditional surrogacy is not used in the United States. It's a gestational carrier, which means that the person or the woman who carries the baby in her uterus does not have a genetic link. The egg and the sperm did come from 2 other parties, and that's why it's referred to as third-party reproduction. So for the purposes of this talk, we're going to use the terminology gestational carrier. Okay, so how do you find a gestational carrier? Does it vary from state to state? I mean, I'm sure, and we'll talk a little bit at the end about the legal aspects, some of the legal aspects, but that's a whole nother topic on its own. But how does one go about finding a gestational carrier?
So I'm going to tell you, this is actually going to be one of my tips that I want to share with you. And I've had tremendous success with this over the last about 8 years. So this applies to LGBTQ couples, but it also applies to anybody that needs a gestational carrier. What I've had tremendous success with is if you are a person who is comfortable enough to talk about your experience, and if you put it out to your friends and even in social media, and I know, hang with me just for a second because this can kind of sound scary, but I have almost always experienced that if someone is willing to tell their story and be vulnerable, that there is a 6 degrees of separation situation for many people where a lot of people know someone in their life that is in their extended circle that has always thought about being a gestational carrier for someone else, but didn't have an opportunity to connect with that person. And I'll give you a couple of examples. Recently, within the last couple of years, I had a female patient whose mother-in-law's best friend from high school's daughter-in-law, if you can follow all that, always wanted to be a gestational carrier, but the two women did not know each other at all. And it was just being vulnerable to put that connection out there. But I've had tremendous success with that. And I've had people, find within their work network, their religious community network, to be able to find a gestational carrier. That's been amazing. Right now, I've got a sister-in-law carrying for a gay couple, and that's been tremendous. Some of the most fantastic humans I've ever met are gestational carriers, because it's such a wonderful thing to do for someone else. If you don't have that option, or you're not willing to kind of put yourself out there, it just sounds like a bridge too far. There are also agencies that will help you find a gestational carrier and help you with some of the legal aspects and some of the screening that you want to do for a gestational carrier as well. But using an agency is also going to come with an additional cost for all of the agency fees, which can be substantial.
Right. And again, just like for the egg donor, a gestational carrier is going to require extensive medical, psychological screening, and just as much as an egg donor would, correct?
Correct. Yeah. And there's also additional implications that come from a legal side. I don't know if you want to talk about that later or not.
Yeah, we'll
there's
talk
a lot
about
of other things.
Yeah. So I know that to be an egg donor, a woman does not have to have had a child, correct?
Correct.
But to be a gestational carrier, does she need to have had a child already?
No. So, no, that's very important. Everybody always has a first pregnancy if you're going to have a pregnancy, and you don't have to have proven fertility to be a gestational carrier. At least that's how I've always practiced, and I've had many first pregnancies as someone that's a gestational carrier. A lot of agencies, when they're screening potential candidates to be a gestational carrier, do want someone that has what we call proven fertility, but it's not necessary.
Okay. All right. So then we go to for the male couple, who donates the sperm? I know you could choose one, the other, or both. I'm sure that either way you go, or whichever way you go, screening also has to be done as far as a semen analysis to see, and maybe that will help if both partners do a semen analysis. Maybe one will have a more favorable profile than the other. So how does that work as far as who donates the sperm, or can both donate the sperm?
Well, you can do both, but I'll say a fairly common scenario that on the surface sounds perfect, but on the back end does not work very well, is that you'll have a couple come in and say, we want to use both of our sperm, we want you to mix it together, or we want to create embryos and we want to transfer one from each of us. Now, that actually would be four-party reproduction. So you've got eggs, sperm, and carrier. And most clinics do not do four-party reproduction. So there may be a few that would be willing to transfer an embryo. Personally, I don't do that in my practice. And so I do have some couples that want to do it, and we talk about doing it sequentially. So in that situation, what we would do is we would try to get a big group of eggs. So we're not talking about a cohort of 6 eggs at this point. We're trying to get at least 12 or even 20 eggs, and trying to split the eggs, fertilize the sperm half and half. So we do have a consistent egg donor, but both partner has an opportunity to create embryos. And then we either do one gestational carrier, and then that person maybe or the same gestational carrier or another one in the future would carry again using the other partner's embryos, if you're following with that. Or potentially to use 2 different gestational carriers at the same time. But most practices are very reluctant to put embryos from 2 different sperm sources into one patient.
And then while we're at the topic of putting the embryos in, are we still favoring single embryo transfer in situations like this?
Yes. So the magic number of embryos to put in is no more than 2. We usually want to do 1, and that's for the really important reason is that the chance of success is very much dependent on the age of the eggs. So when we have a gay male couple that's using an egg donor, the egg donor is always going to be from our most favorable egg age group, which is going to be, and most donors are typically under 32. So the probability of success is really high, and to mitigate the risk of twins, And
Yes.
for me to continue being friends
Mhm.
with my MFM colleagues, we
Yeah.
want to still transfer one embryo at a
Yeah.
time.
Yeah, and I always make that a point to say, and when I hear all the time from all types of couples, we want twins, we want twins. And
Hmm.
yes, I know twins are amazing. I had twins myself, but I want to know why. I'll just put out there, I did use egg donor and I did have twins, but I had multiple failed transfers. I had miscarriages. I had also a failed transfer with donor eggs myself. So that's why
Hmm.
two embryos were put in with me. But otherwise, and then I'll just put that out there. We don't have to talk about it much. I did almost lose my twins. So twin pregnancy is still a high risk pregnancy. And, if everything else is favorable, single embryo transfer is still preferred unless there is any other reason to do two. So I always try to put that out there anytime I talk about something like this, because yes, I do have
Hmm.
twins, but I almost didn't. And, it was a very scary pregnancy for me.
Hmm.
So yes, twins are cute, and it's awesome to have twins. I don't know anything else because they're all that I have, but um, I'm an advocate myself, having gone through what I've gone through, and as an MFM for single embryo transfer myself. So just
Hmm.
putting that out there. Okay, so you said we went through the who donates the sperm. Now then you have the gestational carrier, you had the donor eggs, and then you decided who's going to donate the sperm. Then what happens? You have all three of those parties ready. Now, how does
Hmm.
the party get started?
So it's actually fairly simple. So what we typically do is make sure we have the eggs in our clinic, and then
Okay.
we will freeze the sperm samples often ahead of time. We can
Mhm.
potentially use fresh sperm, but there's one big caveat is that when you are using a gestational carrier, technically the person whose sperm is provided is also considered a sperm donor. Now, because the
Yes, there's.
gestational
Mhm.
carrier is receiving an embryo.
Right.
So,
Right.
in the eyes of the FDA, when you are getting an embryo that is created, it is like getting a kidney from someone else or a
Hmm.
transplant. So, the male partners also have to go through extensive screening. Now,
Right.
this part is always a little tricky, but unfortunately, with the rules of the FDA, gay males are considered ineligible as anonymous donors of sperm. And so I did not make these rules. I don't
Hmm.
like these
Yeah.
rules, but gay males are not allowed to donate blood, for example. And
Yes.
so technically, if you were a gay male who wanted to be an anonymous sperm donor to like a sperm bank, you would be considered ineligible. But
Hmm.
for directed donation to a gestational carrier, that is possible. We have to create a waiver saying that
Hmm.
the donor is ineligible. But um, and because of this, and I'm sorry, I'm getting a little long-winded on this point, but typically we freeze the sperm
It's
ahead
okay.
of time. So we've got frozen sperm, we get the frozen eggs, they're both in our clinic, and now we start preparing the uterus for the gestational carrier. And preparing the uterus for the gestational carrier is a process that takes a couple of weeks. And I always say
Hmm.
that's like waiting for your hair to grow, especially me
Hmm.
because I
Yeah.
just had chemo. That's a separate story. But sorry,
Yeah.
now my dog is going
It's
nuts.
okay.
I'm sorry. I'm
It's
gonna
okay.
make her be quiet. She sees my husband come back from running. Um, so so it takes a couple of weeks to get the lining of the uterus ready for the gestational carrier. And we are monitoring in our clinic the thickness of the lining of the uterus.
Okay.
Once we know it's ready, we're going to thaw and fertilize the eggs so that we can synchronize the embryo up with the uterine lining and try to do a transfer directly into the gestational carrier. So other fancier things can be done as well. We can do things like genetic testing of the embryos to find out that we're
Hmm.
putting in a genetically normal embryo into the uterus as well.
Hmm.
If a couple wants to do that, that's a slightly different process. The embryos are first created and then they're frozen before the transfer, but we prepare the
Hmm.
uterine lining in the same way.
So mostly for gay male couples, they're going through this. It's going to be a frozen embryo transfer, correct?
For many of them, yes, it will
Yeah,
be.
yeah, okay. Embryo frozen, okay. And so when you were talking about the one of the partners or both the partners being considered a sperm donor, there was something called that said that the sperm they're required to quarantine sperm. Is that what you're talking about? Where because it has to be has to be tested or go through other types of testing because of that reason? Is that what that means?
Well, we actually don't quarantine sperm. So,
Okay.
so for anonymous donors, yes. So anonymous
Okay.
donors that donate to a sperm bank, they have to have their sperm quarantined for 6 months, and they get retested for infectious diseases like
Okay.
hepatitis B, C, HIV.
Gotcha.
For a known donor, you do not have to do that.
Okay.
But because a gay male is considered ineligible, the recipient or the gestational carrier has to sign a waiver saying we understand that technically this donor would be considered ineligible to be an anonymous donor, but they can
Gotcha.
be a known donor.
Gotcha. So the as long as it's a known donor, that it's not required that you quote unquote quarantine the sperm.
Correct.
Okay.
And we do not.
Okay. So I think that's all that I had for that. Was there any other points about for gay male couples that any other important considerations that you would want to let us know about that we have not covered?
I think I mentioned this really briefly that genetic testing can be done on embryos, and I'm seeing this more and more commonly. So egg donors tend to have really high quality eggs. So doing genetic testing to prove an embryo is normal is not something that has traditionally been considered necessary. But I'm seeing gay couples want to do it more and more. And part of that is because if you have a gestational carrier, you may have a contract with a gestational carrier to do a certain number of transfers.
Okay.
And I'm seeing more and more couples want to do every possible thing they can to maximize the success of each individual transfer. So I've seen a shift in my practice to see more genetically tested embryos.
Okay, just to make sure that they're, in case any of it, that it is an abnormal embryo for whatever reason genetically, that you're not, I don't want to say the word wasting, but using one of those transfers for that gestational carrier, correct?
Yeah, it's really just trying to maximize the success
that
at each transfer.
Okay, and that makes sense. And so, and then before you get off this topic, why is it important or ideal that an egg donor be, aged 19 to 32 or 33? Why not older?
Well, we're born with all the eggs that we ever get. And as we go through reproductive aging, the quantity and quality of our eggs, unfortunately, tends to go down. And so when we're picking an egg donor, we try to, we do test their ovarian function even if they're young, but typically we try to find women that we think are kind of in the highest reproductive potential group. And that's always really hard to say because I feel sometimes I'm talking to my patients that are like, 39 or 40, and I'm 47, so I would love to be in that age group, and I always feel it comes out as being pejorative. But one notable exception, though, is if you have a known donor, like someone who's going to be your sister, I think the genetic connection of having a known donor, as long as if you had a donor who's 37, 38, as long as she has good ovarian function when we look at it, even though she's not in that kind of ideal group, the emotional connection to have that sometimes I think is a outweighing factor. But if we're purely going to talk about an anonymous egg donor, most of the time we're going to just try to really select people that kind of tick every single box of what would theoretically kind of be the best potential candidate.
Right. Exactly. Okay. So let's move on to lesbian family building. So I also kind of narrowed it down, and then we'll go through each component. So first you have to decide who will carry the pregnancy, who will donate the eggs, and then you determine based on that whether IVF or IUI is needed, and then sperm donation too, where if it's a known sperm donor or anonymous sperm donor. So let's talk about first. You have a lesbian couple who comes in who are wanting to achieve pregnancy. How do you determine who is going to be the one who will actually carry the pregnancy?
Well, sometimes you'll have couples that already have a really strong opinion, and that's one of the first questions I ask is, do you both want to be pregnant? Does one person want to be pregnant and not the other? And all answers are acceptable. Usually I don't recommend that two people are pregnant at the exact same time, just from the complexities of pregnancy, but it's also possible. And really thinking about how big you want your family to be and whether or not both partners eventually would like to carry, that's a very big consideration on selecting a donor. Because if you knew that you wanted to have one pregnancy and you were going to select an anonymous donor from a bank, it would probably be fine to select someone that doesn't have a deep inventory in their samples. But if you knew that both partners each wanted to have 2 children and having the same donor was really important to you, you need to find somebody that's going to be able to have enough samples to make that a realistic possibility.
Okay. And then as far as who donates the egg, so I guess that would depend on, you can, if the same person donates the egg that becomes pregnant, or is the egg donor that and also carries a pregnancy, then IVF is not necessary. You could do IUI with sperm donor, correct?
Correct. Correct.
Versus IVF. So you could have one of the women who wants to donate the egg. The other may want to carry the pregnancy, in which case you would need to use IVF. So can you kind of explain how that works?
Yeah, this is one of my favorite things in practice. So this is reciprocal IVF. I love
Yes.
it. And I just think it's an amazing way for both couples to be involved in the pregnancy. So in this situation, unfortunately, it does require IVF. So
Yes.
one partner is going through the process of egg stimulation, and at the same time, we're trying to prepare the uterus to be receptive for the second partner, so that once the eggs are retrieved, the embryos are created, the fresh embryos are available, and we can seamlessly put them into the second partner's uterus to carry the pregnancy. And that can work great. So that's really, like I said, I absolutely love that scenario.
Okay. And what do you see more of? Do you see more of the reciprocal IVF, or do you see more of the, where this one partner carries the pregnancy and provides the egg?
Right. It really varies. I'd say that it's the reciprocal IVF is less common just because it's more involved and more costly. So I think most people initially think that they're going to come in and they're going to do IUI. Now, one thing that's really changed in the time that I've been in practice is when I was a fellow in 2005, the cost of a vial of donor sperm was about $200, and the cost of a vial of donor sperm now is $1,000 with shipping. So what some people don't realize is that if you are going to be doing IUI, the chance of success for IUI is not going to likely be higher than about 20% per month. That the tab of buying donor sperm can add up really, really, really quickly. So one thing that is also, I think, a really good option, and reciprocal IVF can be done with this, but for people who are using donor sperm, there's a newer treatment called InvoCell as well.
Yes.
That can work really well. I brought one of the devices home with me. So this is an InvoCell device. And so what this is, it looks like a champagne cork, but women go through a process to get multiple eggs to grow. And the eggs are removed from the body, really similar to what we do in IVF. But instead of sperm and eggs getting mixed in the laboratory, they're put in this chamber. So inside here, there's a small conical tube. This gets put back into this holding device, and the patient incubates this in her vagina for a week. And then for 5 days. And then after 5 days, patient returns to the clinic. We take everything out. We open up this inner part, and hopefully instead of sperm and eggs, we have embryos, and we can put one embryo back into the patient or into the partner for a reciprocal InvoCell situation. And this ends up being more expensive than IUI, but more effective. So for most women, we see a chance of pregnancy of about 40% in our practice versus 20% for IUI. And if you had extra embryos that were available, you could freeze them for the future. So I think for people that are using donor sperm, InvoCell is a really nice option just because of the expense of the sperm at this point.
I'm glad you talked about InvoCell because I've heard about it and I couldn't wrap my brain around how it works, but it seems like it's really cool. Is it something that you're seeing more and more of, or is there a certain situation where you would say, you know what, I know IUI is less expensive, but I think based on certain factors that InvoCell might be more productive or more chances of success for you? Is there a way to determine?
Absolutely. So, it's another thing about InvoCell is I've seen a lot of patients. So InvoCell is relatively new to the United States, but it's not new in general. A French scientist invented the earliest technology about 30 years ago, but it hasn't really taken off in the United States until the last couple of years. So it is more cost effective than doing IVF, and doing InvoCell would be roughly the cost of doing 3 or 4 cycles of IUI. And so, but it just works better. And a second benefit of InvoCell that I mentioned kind of before, but if you had extra embryos, let's say you had 3, you transfer 1 now, you freeze 2 for the future. Now, even if that donor that you have is not available in the future, you've got embryos that are there. And there are some people who fundamentally just see this as being more natural. I'm incubating this myself instead of having it be in your lab. That might be a little false economy in your thinking, but I think this appeals to a lot of
Yeah.
patients from the cost standpoint, but I also agree that when you first hear about it, it just sounds kind of
Yeah.
off the beaten path, and why wouldn't you just do IVF?
Yeah, so just to clarify, so one partner would go through the stimulation to have the eggs retrieved, right?
Hmm.
And then the eggs and the sperm from the sperm donor go into the InvoCell
Hmm.
container, and she can either carry that in her body and then have it transplanted, the embryos put back into her uterus. But
Hmm.
are you also stimulating the uterus at the same time to get it ready?
Well, if you are putting it back into your own body, your uterus is going to be ready. So
Ready, okay.
you're kind of going through the IVF process or something. You are taking the medication, so you are ready. But
Right.
you could also use this for a reciprocal process. So, for example, you could go through the process, get your eggs retrieved, and then you could carry the device, or your partner could carry the device, and the partner, if her uterus was prepared along simultaneously, could be able to get the embryos transferred as well.
Okay, okay. And but if the other partner was to carry the embryos, you would have to start getting that
She
lining
would, yeah, she would need to get the uterus
of the
ready. Yep,
uterus. Yeah, right.
yep.
Gotcha. Okay, so that's pretty cool. Yeah, I heard about it on social media, and I'm super excited that you got to explain it to me because again, I just didn't understand it, but now I do. So let's talk about cost of donors. Well, so one question keeps formulating here, and both for the previous topic we addressed, and then this one. What is it like to find let's talk about donor sperm. Do you
Hmm.
just go and you do have a drop down menu with a bunch, like if I'm shopping online and I want to pick, is that how do you, what is it like? Do you see pictures of the person who's donating the sperm? How much information do you get on the person that's donating the sperm? Do
Hmm.
you have, is it just like I guess they have sperm banks and then they ship it to you
Hmm.
to use for this couple. So what is it actually like to find a sperm donor?
Well, I'm cringing a little bit when I'm about to tell you this, but this is accurate. So there are a couple of important points. One is sperm banking is a business. So,
Mm,
so when you get sperm, it costs more to get sperm from donors who usually have a PhD or an
yeah.
advanced degree. It can cost more to have a donor that looks a certain way or is willing to give you more information, would be open in the future to meeting any offspring.
Yeah.
And each one of those little bits adds to the cost.
Yeah.
Now, all sperm donors have to go through the FDA mandated screening. So you
Yeah.
aren't going to be getting a risky donor in one category or another.
Mhm.
Most sperm banks also have search functions. And so one important point is you don't have to pick a donor that is anything like you. A lot of
Mm,
people do. You can pick someone of a completely different
yeah.
ethnic background. That's okay. But most donors, you'll get information about kind of height, weight, eye color, hair color, education level, job, hobbies, and interests. Sometimes the sperm bank will make a comment. There are opportunities for some sperm banks where usually you have to pay extra, but you can see picture, childhood picture, a voice
Yeah.
sample, handwriting sample,
Mm,
all kinds of information. You can search to look for donors who are similar to a certain celebrity. So
mm.
that's a function that some banks have.
Uh-huh.
And like I said, each piece of information that you get adds a little bit more to the
Yeah.
cost. You'll also notice that there are some vials that are prepared for IUI and some that are prepared for IVF. The reason is that you need different amounts of sperm for
Okay.
each. So that's also something that you're going to notice pretty quickly. My top tip for couples who are going to pick a sperm donor, though, is to make a short list of several candidates, because
Hmm.
I have had many times in the past couples who really agonize over trying to find the perfect donor.
Yep.
They just spend a lot of time, a lot of discussion, and they just narrow it down to one person that they have their heart set on, and then they go to order the sperm and it's not available.
Right.
Or they want to do IUI and there's only IVF vials. So I would get a short list of several vials.
Mm,
And then the sperm is usually shipped to my clinic. So
yeah.
it's not like you have to be responsible for getting it shipped to your house and transporting it to me.
Yeah. And since we're talking about it, the process of finding an egg donor is similar. There's probably not as many egg donors as there are sperm donors for obvious reasons. But, when I was going through the process, there's egg donor registries all over the
Mm-hmm.
country. And it was hard. And I'll just say my experience briefly. It was hard for me to look through the catalog, if you will, because it was like I was finding someone to replace myself. So I was like, I told my husband, hey, why don't you look and we'll narrow it down to 5 people and see where they all are, based on certain criteria. Where he was going crazy with finding the perfect egg donor.
Mm-hmm.
And he was looking all over the country. And I just was like, wait a minute, we got to rein this in. We got to narrow down the top 5 things that are most important to us. Otherwise, we're never going to find anybody that's perfect. And then find those people and then choose the top 3 and go from there. I mean, I joked with them. I said, this is not match.com. This is, we're not going to treat it that way. And, but, I think it's important between the couple that you guys decide what's most important to you. Would you agree? Like, you can't let it envelop you too much, or you're just going to never find the right donor.
Yeah, I think it's a place where you can just go down a rabbit hole that is extremely, extremely deep.
Yeah, and I think my husband was going down the rabbit hole. So I had to say, we need to just kind of narrow this down. So we picked 5 things that were most important. Once we did that, we found 5 candidates, and then I picked the top 3. Then we put out the feelers to see who was available, and that's how it happened. And then that process switched much quicker after that. So yeah. Okay, so there's multiple options for both gay couples and lesbian couples, obviously. So now we're going to jump into trans family building. So the first thing I wanted to talk about is fertility preservation.
Mm-hmm.
What is that, number one? And when should that be entertained or even thought about along the process?
Well, I think this is probably the most critical factor for it. So I hope that most people who are undergoing the process of gender reassignment and being counseled early on about the process of fertility preservation, because it is true that you could potentially stop hormone therapy, but you're going to need to stop it for a while. And it would be much better for most people to upfront, before hormone therapy started, either freeze sperm or eggs, to have that available as an option to use in the future. So if possible, and usually deciding that you're going to undergo hormone therapy is a very considered decision for most people. So there typically is, this is different from fertility preservation, for example, in a different context. So we think about fertility preservation for a lot of cancer patients, where you're getting a really serious medical diagnosis and time is of the essence. So with undergoing hormone therapy, there's usually a little bit better window of time to be able to do what you need to either cryopreserve sperm for future use or collect eggs. So I would say upfront, that's probably the most important piece, is to think about that before you start hormone replacement therapy. But for example, if hormone replacement therapy has already been started, for example, sperm production typically takes about 3 months at least to recover. So if you were taking estrogen and you would have to stop it, wait at least 3 months before you could do a semen analysis and see if the recovery had been there, but it may even take longer than that. So it would be much easier, I'd say, even psychologically, to not have to stop your treatment for that prolonged period to be able to have something preserved up front.
Yeah, so I think it's an important thing to consider before, fertility preservation, because, it's becoming more common that this is happening for trans couples. So considering before hormonal therapy, preserving sperm and eggs is vital. Now, one thing that I heard is that, or read, is that even if you stop the hormone therapy as a trans man or trans woman, return of fertility is not guaranteed.
Correct. Yes. So that is a risk that is there.
Okay. Okay. And from your experience, do you find that it's more common, or are there any studies that show that for trans men or women that certain percentage of the fertility is not returned, or is it just still too new to know that kind of information or that data?
Well, I think one of the other, there isn't a study out there that tells you that. The really important piece, for example, if you stopped your hormone therapy to go through an egg retrieval to try to use your own eggs, age is going to be the really more important factor, other than the hormone therapy that you've received. So
Okay.
any egg source, the age, if you are in your 20s and you stop your
Mm.
hormone therapy, it's going to be so much more successful than if you are older, 35,
Yeah.
37, 38 or older. So I think age is probably the more critical factor.
Yeah.
And I'm not sure, because there's such a heterogeneous population
Yeah.
of trans patients, that there really isn't literature that says X% during each time, but age is going to be the bigger piece of the
Right. And
puzzle.
that's an important point. And the other thing to consider as well is for trans family building, there's still the option of gestational carrier, sperm donation, egg donation as well. So that could still
Absolutely.
apply
Hmm.
for trans family building. So, I think, I'm sure in any situation for LGBTQ family building, you know, couple or individual, the whole picture is going to be looked at by the REI to determine, who's the best possible donor, or, you may need to consider donation, egg donation or sperm donation, based on medical history. All that has to be evaluated for each individual, the age, as you mentioned. So there are a lot of things to consider so that you guys will tell them the most optimal way to proceed in order to have the best success at achieving pregnancy.
Yeah.
Yeah. Okay. So let's talk about you. You had sent me some notes about a couple of things you wanted to talk about. So
Hmm.
one of the things you wrote was hidden infertility can be uncovered during the course of treatment. What do you mean by that?
Yes. Okay. So, but if I am seeing like a heterosexual male-female couple that's coming to see me, typically they already know they're infertile.
Okay.
So they've experienced
Yeah.
I got my period, over and over again. And unfortunately, it's just been a series of kind of disappointments, I guess, that
Yeah.
even brought them to my door. And so there are times where I see LGBTQ couples who come in and they haven't tried to become pregnant before.
Right.
And so, that's a really optimistic scenario. It seems like it's going to be really easy. And if it isn't easy, I can sometimes see couples end up feeling more disappointed
Mm.
than the heterosexual couples who kind of, not that I want anyone to be disappointed, but they have been heterosexual couples that have been trying to get pregnant for 2 years without success, have kind of been on that merry-go-round for a
Yeah.
while. And it's not the first disappointment.
Yeah.
So there is an opportunity, I think, for some LGBTQ patients to feel kind of more devastated when that
Okay.
first IUI doesn't work, for example.
Mm.
And the other thing about hidden infertility is, if patients haven't tried to become pregnant before, and we're trying and we're trying and we're trying, and IUI isn't getting us where we want to be, and we go to IVF and we don't get good results from that, again, it's kind of that underlying factor that was there. And because it doesn't seem obvious at the start, I do sometimes find that it can be very disappointing. I had probably one of the most profound things that someone ever told me, and I want to say it carefully so it comes out the right way, but
Mm-hmm.
I had a wonderful gay couple who are successfully pregnant right now with their gestational carrier, but they had a transfer last year, and the first transfer wasn't successful right away, and they were absolutely devastated,
Mm-hmm.
and lots of sadness and grief. And after they had processed it for a while, one of them told me, I realized that I just can't buy a baby. And
Mm.
I don't think he actually thought, that's not what they were intending to
Yeah.
do, but
Yeah.
it
Yeah.
just
Yeah.
seemed like all you need to do is get the pieces of the puzzle
Yeah.
together. We're going to get these eggs. We got our friend that's going to carry for us. We've got the sperm. We've got the embryos. Of course, it's going to work. And when it didn't work right away, the
Mm.
tough thing is with what I do and with what you do, the stakes are
Mm.
always so
Yeah. Yeah.
high that it
Yeah.
doesn't feel like there's room for error at
Error.
all.
Yep. Hmm. Similar for me. I got pregnant for the first time at almost 40 and had a miscarriage. Then went through multiple cycles of IVF and had a failed embryo transfer of the only genetically normal embryo I was able to get. And that was rough. But then once we decided to go to egg donor, the first two that they transferred failed. And I will say that was the worst loss. I mean, I think because was like, okay, I'm going to do egg donor. Now I want to get pregnant. And I just had so much, I guess, expectation that I didn't even think for a second it wasn't going to work.
Hmm.
And that was probably the most devastated loss that I had had. So I understand that does make sense, because I thought, I'd done everything and I tried. Yes, that didn't work for me. Now I've relinquished that I can't have my own, through my own eggs. So I'm going to get an egg donor, and it didn't work the
Hmm.
first time. So yeah, that was pretty rough, and I get it.
Hmm.
Okay, so let's talk a little bit about legal stuff.
Hmm.
We'll close it with legal stuff because that's
Sure.
always fun to talk about. The legal aspect of third party reproduction is crucial, and finding the right legal representation is important. I found that most centers, such as where you're at, they have certain attorneys that they recommend, because those attorneys are versed in third party reproduction, and so this
Hmm.
isn't their first rodeo. So
Hmm.
hopefully most centers do have attorneys that they recommend. But how do you go about finding the best attorney to help you through this process?
Yes, so this is really important. Now, one thing is the law is also very clear that if you go through a licensed medical clinic, that even if you're a known donor, once you donate the eggs or the sperm, you have neither rights nor responsibilities. That is very different than someone who does a DIY at-home insemination.
Hmm.
Even if you prepare your own contract with someone that maybe is a known
Yeah.
donor, that is not going to hold up in court in some
Okay.
cases. So trying to go on your own, even if you think you've done something to protect yourself,
Yeah.
may not be adequate. So I wouldn't advise that.
Okay.
And then as far as contracting goes, there are so many things to think about. Now, so I'm in Minnesota. And when someone is delivering a baby as a gestational carrier in Minnesota, it varies by county. But legally in Minnesota, if you are a woman who is married, in the eyes of the law, your legal spouse is considered the father and would be responsible for the offspring. So if you are a gestational carrier, what you want to do is be able to get a pre-birth order ahead of
Mm.
time, so that when the baby is born, there is no after the fact kind of
Yeah.
almost adoption process that has to happen.
Okay.
You ideally want to have your name on the birth certificate. So you want
Mm.
a lawyer that knows how to do that.
Yeah.
And I have worked with many reproductive attorneys who are experienced in this. And it's a short list, even in a
Yeah.
large city. So one resource is to look at people who are in family law, or look up
Mm.
adoption law, surrogacy law. What is less successful is sometimes I'll have someone say, hey, my cousin's an attorney. They're going to pull a boilerplate
Yeah.
contract
Yeah.
off the web, and it doesn't work, because you
Yeah.
really have to think about things like, is your
Yeah.
gestational carrier going to get one embryo or two?
Yeah.
What if there's a problem with the pregnancy? Who's going to be informed? Who's going to be in the delivery room? How are you going to do the birth certificate? There's so much complexity that you really need somebody
Yeah.
who is versed in this type of law.
Yeah. So like you said, I mean, the laws are different from state to state, but even within each state, within each county, correct?
Correct. Yeah,
So
in my state it is.
yeah.
Another thing to consider is insurance for your gestational
Okay.
carrier if you are using a gestational carrier, because that can vary. Some people's
Mm.
policies might not cover them for the obstetrical piece if they are discovered to be a gestational carrier. There are so many aspects that a lot of people have never thought of, that you
Yeah.
really, again, want someone that has experience in doing this for you.
Yeah, and like I said, most I'm sure all fertility centers have people that they can recommend.
Hmm.
But also, I think from my experience, because we had to go through use an attorney as well because we had egg donor. I
Hmm.
never had to have a direct one-on-one relationship because everything was done through the center. Is that generally how it's done in most situations?
Well, not.
Or you go
Okay.
ahead.
Well, so an egg donor can still be anonymous. And so
Okay,
a lot of times from the egg donor piece, patients never even meet the donor. If you're going to get eggs
gotcha.
from an egg bank, by definition, though, a gestational carrier is not going to be anonymous to you.
Right, right.
So,
So yeah,
and the other
that's a good point.
key piece is you really should you and the gestational carrier should also have your own
Own
attorney,
attorney.
so that you don't have kind of a conflict there.
Yeah,
But I forgot this part to mention
yeah,
before. The other thing you want to talk about is what kind of relationship are you going to
yeah.
have after the baby is born going forward. That's also critically important.
Is that usually determined beforehand?
Yes, and
Okay.
and it's not even really the attorney that does that. We have
Yeah.
counselors that meet for a
Mm.
group counseling session to really set those expectations, because I've seen things where The carrier is a really fundamental part. Breastfeed, we'll ship breast milk for months, and other times where the carrier is really almost more contractual and doesn't have any contact once the baby's born.
Yeah, so you also mentioned one other key thing, and we could talk about that, and then we have about 10 minutes to answer questions. But the counseling part, I know I met with a counselor several times through the process. I'm sure that's encouraged to make sure, all feelings are worked out, and even through the process, if it's not working out directly as planned, having a resource that you can go to help with counseling throughout this whole process, because sometimes it can be very emotional, and it's helpful I highly recommend it. I think it's very helpful to talk through that process and have that resource available for counseling. Okay, let's see what kind of questions we have here. Sorry, I gotta scroll up. We talked about how do you go about choosing sperm from a sperm bank. We already talked about that. Do most fertility centers recommend sperm banks? Do some fertility centers have their own sperm bank? How does that work?
So most fertility centers no longer have their own sperm bank. So laws changed on how banks had to be run and requirements for banking about 12 years ago. And because of that, it wasn't effective any longer or worth it, basically, for centers to have their own sperm banks. So what you saw over the last decade is just kind of large sperm banks being national conglomerations. And we work with several. So there are several good sperm banks. The FDA requirements are the same at every place. So
and for egg donors, I know that some centers do have their own egg donor registry. Right?
We do. Yes,
Okay.
we do. So we do. The FDA mandated screening, again, is exactly the same as for eggs that you might get from an egg bank. But because we sometimes still use fresh egg donors, we maintain our own donation program as well.
Right. And then another question I had about for trans family building. When we talk about coming off the hormones, if the fertility preservation wasn't done, if they come off the hormones to as a trans woman or trans man and are coming off the hormones, is that something that the REI manages? Is that something you guys do?
I can, yeah. I mean, usually I'd work with someone's endocrinologist and we'd have a relationship together. But, in my own practice, I've shifted. So I don't do a lot of the hormone management long term. I have done that before in a prior position. I had, so I'm really comfortable with doing that. One thing is you really, if you are going to carry a pregnancy, you really can't resume taking testosterone, for example, because there is a risk of birth defects for the baby. So, it's a long-term consideration of what you need to do.
And that's a conversation that you would have with both partners that would also obviously go into the consideration for who would be the better candidate to,
Absolutely. It takes a lot of planning ahead of time.
Yeah. And then once, and just hypothetical, hormones are discontinued, does it determine, like, what makes the determining factor is when they can reinitiate the hormonal therapy?
Well,
afterwards?
So, for example, if you were a trans man and you were taking testosterone, but you wanted to become pregnant, and then you stop taking the hormones, it really depends. If you have a pregnancy, you would need to be done breastfeeding, for example, in order to safely resume hormone therapy. So there really would be a prolonged period of time that someone would need to be off therapy.
Yeah, so all that should be considered ahead of time. But I think that's the main questions. Most of the ones are here we already addressed. So I want to thank you so much for this topic. It was awesome, and it's one that my audience has been asking about for a long time. So I truly do appreciate you taking the time to do this. So how can the audience find you on social media?
So I'm Fancy Lady Doctor. That's my nickname from med school. It's hung around for 20 years. So I'm here on that. And my practice is rmia.com. My email is drjensen, Dr. Jensen at rmia.com. I'm in Minneapolis. And like I said, this is one of my favorite areas of medicine to practice.
Yeah, when I was fishing around for someone to do this talk, your name kept coming up over and over and over again. I'm like, okay, I gotta ask her.
Oh,
so
thank
I
you.
do.
Yeah. Well, I'm happy to come back and talk about anything else too.
Absolutely, yeah. I think I'm sure from this topic, what I usually do is I get a bunch of more questions that need to be answered after people watch this, and so I'm sure you'll hear from me again.
I love it. Okay.
Okay.
Good.
Thank you, and have a great day.
Same to you. Okay. Bye,
Bye bye.
everyone. Thanks.